You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with the new small diameter or mini dental implants. According to my first guest, Dr. Hawkins, he says nobody should be wearing a loose fitting denture. Dr. Hawkins, welcome to the program.
Thank you very much, Randy.
Welcome back. Now, we had you on the show probably 4 or 5 years ago or close to that. What's changed since then?
We've done a lot more many implants since I've been at the show. Gotten more confident in doing them. Gotten a lot better at doing them. It's a very technique sensitive implant that you have to place. It's gotten, and the office has grown.
Is that right? Now, the people that come in, a lot of them see you on TV.
Yes, sir.
And you say they watch it like 4 times and they're still skeptical when they come in.
Yes. They're scared to come in because they've been told in the past they don't have enough bone. And a lot of times we can help them. Most of the time we can help them. 90% of the time we can help them.
Is that right? So no more dentures. Like when we say that at the top of the show, nobody should be wearing a traditional denture that's not attached to anything. You believe that?
Yes, that's one of my goals in life, is try to get everybody that's got a denture that's not attached to get one that is attached.
In your town, are there a lot of denture wearers?
Yes.
Or like within 100 miles of your practice?
Yes, we have a lot of denture wearers. It's so many denture wearers in my town and surrounding areas. It's enough to fill the Ohio State football stadium.
Is that right? There's that many people?
Yes, 10 times.
Is that right? Now, if it's so good then, if replacing missing teeth with the mini small diameter implants is so good, why aren't they all doing it? I mean, what's your take on that?
Well, I think that a lot of people, once they get their teeth out, they think they're done with the dentist. They say, thank you, Jesus, I'm done. I'm out of here.
Okay.
I never have to see you again. If you're wearing a denture, you don't go to the dentist. Let me tell you about your life before you got a denture. You went to the dentist all the time. You seen me, you got your teeth clean, you got root canals, you got crown and bridge. 13, 14 trips to the dentist, and all of a sudden you just say, enough is enough. You stop believing in it into the dental field. And so
there's a lot of money, obviously, to save their teeth, and then they lose all their teeth.
Yes, and it's not as though they're not brushing their teeth. They're taking care of their teeth. They're spending time at the dental office, but sometimes it's simply genetics. You just don't have the good draw for getting good teeth.
So so these denture wearers, it's hard to get them in because the last thing they want to do is go to another dentist again.
Yes,
right?
Yes, sir. Once they get their teeth taken out, they think they're done with the dentist. And what happens is they go along, they wearing glue, they think it's functional. They think this is what mom and dad did. This is my life, and it doesn't have to be that way.
Okay. Now we should mention in dentistry, there's not a recognized specialty for dental implants, but this is your focus. I mean, this is almost all you do. Is that right?
Well, we do it all.
Okay.
Yeah, we do it all. We do extractions, fillings. I do everything but root canals.
And you say people will see you on television, and some of them drive 2 hours with a denture, and then they go to you, and they can walk out with with teeth that don't come out. Is that right?
Yes, sir. We've had patients drive as long as 2 to 3 hours. A lady actually came into the office, drove about 2 or 3 hours to get to the office. She was in the waiting room. I walked through the reception area. She's waving at me. She's waving at me. We get her back in the back, and she takes.
So she recognized you, like, Dr. Hawkins, how are you? Okay.
She's pointing to her friend. She brings her family. She's pointing to me, saying that there he is, there he is. So we get her in the back. We sit her down, and she starts crying.
Oh, wow.
She says, I can't go to a restaurant. If I go to a restaurant, I had to look online to see what they're serving. I can't. Only thing I eat there is basically soup. So she has to look and see what kind of soup they have. And she says, all I want to be able to do is eat a salad. That's all I want to do. I want to be able to eat a salad. So we got her. We took some images, and for her, what we did was we got her a full set of lock-in teeth. So now when she goes to the restaurant, she can eat what she wants. She can do what she wants. She goes to play poker. She can play poker with her friends, smile, laugh, and don't have to worry about her teeth falling out.
Now, when it's all done and they look at the mirror, are they surprised?
They're shocked. They're shocked that they look so nice. They're shocked that they can't push them out with their tongue. They're shocked that they can talk now without things falling down.
Is that right?
Yes.
Now, how old can you be to do this?
I've had patients as old as 90, 95 years old.
Why would a 95-year-old want to do this?
Because what they want is the same thing me and you want. They want to be able to smile with their friends. They want to eat what they eat. It's all about quality of life. We had an 85-year-old come in, and she said she wanted a set of teeth. She had another dentist that extracted all her teeth. She said she couldn't eat anything. She needed, her lower denture floated all over the place. She had glue she was wearing all the time, swallowing half the glue, she would tell me. She said she couldn't eat anything. So we gave her a pair of lock-in teeth on the bottom, and she can eat whatever she wants to eat now.
How soon can they eat? Like after the procedure, if everything goes well, how soon?
That's a good question. I had a gentleman come in, and we gave him a pair of lock-in lower dentures, and lock-in teeth, excuse me, and he took his granddaughter to the movies that night. I called to check on him, make sure I call all my patients to check on him. Called to check on him. He said, I'm a little sore. I said, what are you eating? He said, I'm eating popcorn and I ate a hamburger. He said, I had popcorn in 4 or 5 years because now he can eat it with his lock-in teeth.
Is that right?
Yes, sir.
So they look real. I mean, these are upper and lower teeth. I guess there's an option. Snap in, snap out, or permanent teeth that don't come out.
Yes.
Is that, I mean, are you doing a lot of that?
We're doing a lot of both. We're starting to do more of the permanent teeth because that's what everybody wants. Nobody wants the lock-in teeth to come in and out. They want something permanently stays in.
So you're doing a lot of that.
Yes, sir.
Now you're training because you've trained, I guess, with some of the pioneers in the industry.
Yes. I've trained with Mish, Dr. Carl Mish, God rest his soul. I've trained with and Todd Shacken.
Okay, and these are the mini implant kind of guru guy, this Todd Shacken. So now there are dentists that come on the program, and they've told me, they say, Randy, the problem with mini implants, they're not big enough. The problem with mini implants is they're just not there yet. There's no science behind this. What do you say to that?
Well, it's a 12-year study out now with mini implants, and I think it's about 95% survival. It's the same as with the traditional. Both products are fantastic. Matter of fact, I did traditional for 17 years.
Oh, is that right? So you've been doing dental implants that long?
Yes, yes.
Why did you switch to the mini implants?
The mini implants are more affordable. It puts it in everybody's wheelhouse. Now people can afford it. Traditionals are fantastic, but you have to have the bone, and you have to have a couple different surgeries. The smaller the mini implants, you don't have to have as much surgery.
Now you say it's life-changing for many of these people.
Yes, I've seen it over and over. Once you deliver these people either the lock-in teeth or the permanent teeth, it's the only thing that I do in dentistry that people will start crying in a chair, even one implant. One implant, they will start crying in a chair. They are so happy that they smile and now they're back functioning again. Now they can do whatever they want to do. They can go out with their friends. They can go to the mall. They can go eat corn on the cob. They can do whatever they want to do.
Do you hear a lot of eating stories?
Yes.
Did they ever call you and say, Doc, are you sure I could eat this?
Yes, just like the gentleman I was talking to you about earlier. He took his grandkid to the movies, and now first time in 5 years he's eating popcorn, and he said he was eating a hamburger.
But don't you tell him take it easy at the beginning?
I do, and I told him the same thing. And that's what I told him on the phone. Take it easy on that popcorn. But he said he was so happy that he could eat popcorn with his grandkid.
We should mention Medicare, Medicaid doesn't cover the mini dental implants. So what's the answer for people?
Oh yes,
on a tight budget.
Yes, we have that covered. When you come in there, we have all kinds of different financing. We can go 2 years free, interest free. We can go 4 or 5 years where it might be a small interest attached to it. All you got to do is have decent credit, and we'll see if we can help you.
Okay, so you're not financing it, carrying it yourself, but you have lenders that lend on dental procedures.
Yes.
And they're really doing it? It's that common?
Yes, it's that common. We're doing it every day. And sometimes, yeah, the best one I always tell patients is the 2 years interest free. Use somebody else's money for 2 years. And if you don't want to do that, we got something that's a little bit too high. We got something we can extend it out 4 or 5 years.
So every week, I mean, because people see you on the show. I mean, so every week you're doing this.
Every day.
You're giving people their teeth back.
Every day we're doing this, yes. Every day we're doing it. This patient came in. She already had.
Let's take a look.
She had an upper denture.
Okay.
She had a lower partial, and her front teeth were in pretty bad shape. And what we did was she said, I can't go to a lower denture. I just can't do it. I know I like my upper denture, but I cannot go to a lower denture. My mom's got it. She can't wear it. And what we did was we extracted all her lower teeth, and we put her in a snap-in teeth on the bottom.
Okay.
A lock-in teeth on the bottom, and she's doing fantastic.
She can eat whatever she wants. So they could eat like things like salads?
She can eat whatever me and you eat, she can eat. She can eat salads, she can eat hamburgers, she can eat corn on the cob, she can eat anything she wants to eat.
Is that right? And these were with the mini implants?
Yes, sir. Here's another patient right here.
All right.
She's seen our interview, and she came in and she wanted to know if I could help her with her lower denture. And I said I could, and we took the imaging, and it looked pretty good, and we got her a full set of teeth on the bottom that snap in, and she's eating whatever she wants to eat. She's doing whatever she wants to do now.
What are the frequently asked questions? So a patient might see the interview that I've done with you. They come in, what do they want to know? Are there like 2 or 3 things they always want to know?
They want to know if they're going to be able to eat. Men want to know if they're going to be able to eat a steak. Women want to know if they're going to be able to eat salad.
Okay.
And they want to know if they're a candidate for these because they've been told someplace else that they can't have implants because they don't have enough bone.
Okay.
They want to know, and most of the time, 95% of the time, they're candidates for it, and we can help them.
Now, you mentioned a few times that they were told elsewhere that they couldn't get it done, but you were able to do it. So what are you doing that these other guys aren't doing? I mean, what's different?
What's different with me is with traditional, you need more bone.
Traditional implants we're
Traditional because they're bigger. The smaller diameter, we don't need as much bone to work with. This is another professional that's in the public eye.
Okay.
He's in front of people all the time. He's always talking. He came in, sat down. This professional's in the public eye all the time. He said, I seen you in for commercial. Can you help me? He said, don't BS me. Tell me if you can help me or not. He said, I want to get both of them done, but I want to start on the lowers.
His teeth are pretty bad right there.
His teeth are bad.
Well, that's got to be unusual to see teeth like that.
No, it's not unusual in my office. People come in like that. The reason people don't see it is because everybody keeps their mouth closed. They don't let nobody see their smile because they don't have a nice smile. He came in, sat down at the chair, and we took some imaging, and we got him a pair of permanent lower teeth. And he's eating. He hasn't been back in. It's been about 6 months, and he's doing fantastic. So he's actually coming back to get the uppers done. But yeah, he's very, very happy with the lowers. He thought he wanted a snap-in teeth on the bottom, but he decided he wanted permanent, and that's what most people
you say
want.
Most of the people that you help, and you told me this in the green room, that it seems like they were not happy with their teeth for like 10, 20 years before they do something about it.
Yes, sir.
Elaborate on that.
Yes, sir. This patient right here, she came in, and she hated her teeth. She seen our interview. She came in to see what we could do to help her. And what we ended up doing with her, we sat down, we went through all the things. So what we did, we got her an upper permanent set of teeth. And she's happy as happy, and it looks really, really nice on her. We got a before photo of her smiling, and that's how she smiled.
That's her smiling.
Yes, everybody thought she was mad all the time. And we went through the whole process, and we got her some upper teeth. And now she's smiling all the time, and her grandkids don't have anything to say to her. But
is that right?
All your teeth look nice.
So her option would have been a denture.
Yes.
Because you couldn't save those upper teeth. Right.
Yes, sir.
I mean, that's basically why they go to you, because they don't want dentures.
Yeah, she had some infection in her gums, and came to me so we could take care of her.
You say they changed. Like once it's all done, you give them a new set of teeth. They come in for follow-up treatments, things like that, and they're not even the same people. What do you mean by that?
They come in, they usually dress, they usually have some nice makeup on when they come back in with their new teeth. Life has changed for them. It's now they can go out and they can eat what they want to eat, they can do the things they want to do, smile at who they want to smile at. I had this other patient, it was an older gentleman, he came in and he came in with upper and lower denture, skeptical. He didn't think we could help him. He kept every step along the way, he was asking me, is this gonna work? This is not what I pointed at, this is not what I wanted. Along the way, and I said, you're gonna be happy when we get done. We got done, we gave him a permanent set of teeth on the top, permanent set of teeth on the bottom. Now he's taking pictures with my dental assistants and having it framed and bringing it back in and giving it to him. Happy as happy.
Is that right?
And we couldn't get him to smile to save your life. And he said he never smiled. He said he never smiled. And now he's smiling as big as big.
Okay, good. Now you brought more photos. What else are we looking at?
This lady came in and she wanted to know if she was a candidate to get the smaller diameter implants, and she had a upper denture.
That's a denture?
Yes, that's a denture she's probably had about 5 to 10 years, and as you can see, it's stained. She hated it. She said she never smiled. She was wearing a lot of glue with it. She couldn't taste food. So brought her in, sat her down. We did some imaging, and we was able to give her a pair of permanent teeth on top that she absolutely loves, and that she can eat what she wants to eat, and they don't come out.
So nobody should be wearing a regular denture. I mean, is that your feeling? Like they should all be attached to something?
In my opinion, everybody that's wearing the denture, it should be attached. The lowers especially. So now you can function like you can eat what you want to eat, do what you want to do, and the upper, so you can taste food.
Now, what do they like more? Do they like the way it looks, like this new smile, or do they like that they could eat?
It's funny because they come in and they usually come in and say, I don't care what it's going to look like, I just want to eat. That's the guys. Then as soon as you give them their permanent teeth or the snap-in teeth, the first thing they do is, oh, well, this is a little bit off right here. And they become dental connoisseurs. Then they start getting the compliments That thing looks nice as they're eating the corn on the cob.
Okay.
The women come in and they want the cosmetic part of it. Or sometimes they want the eating part of it. But most of them come in, they want the cosmetic part of it. Then when we get it to them, and now they're able to eat, they say, man, I can eat what I want to eat, and I done put on 5 to 10 pounds. So I don't like you for that, but you got me.
So they came in for just have a pretty smile, but they end up liking the eating.
Yes.
And then the guys come in, they just want to be able to eat and chew, and they end up liking the fact that it looks good.
The cosmetic, but yes, that looks good. Now they're getting compliments. So little people are smiling at them. Yes, the wife's kissing them more. Yes.
Now you say they start posting selfies, like on Facebook or Instagram. Like, do they ever send you these photos?
Sometimes I
Like
do get
pictures of themselves?
Yeah, and I give my cell phone out to everybody. So I've gotten selfies over my cell phone through a text and stuff, talking about, look at my smile, look what I'm eating.
Okay, good. So you brought more photos. Let's take a look.
Yes, this patient had her teeth removed 20 years ago, and the only thing she had left was some upper teeth.
Oh my goodness.
Yes, and the first thing she wanted to know was, could we help her? Did she qualify? Did she have enough bone? Because she had been told before she didn't have enough. We did our imaging, and she had enough bone for our mini implants, and we got her I believe it was an upper denture and a lower attached teeth. So she's very, very happy with what she has.
Is that right? So the lower, you could do a snap in, snap out. I guess that's just a more affordable option.
Yes.
Spend a little bit more, you get teeth that don't come out.
Yes.
But that's what everybody wants, right? Teeth that don't come out?
And I tell all my patients to come in and they can just maybe afford just the lowers, snap in, snap out teeth. And then 4 or 5 years down the line, if they save their money, they can come back in.
They can upgrade.
They can upgrade, exactly right. And all you paying for then, I might have to place 1 or 2 more implants, but it's not going to be the same cost. And now it's a little bit more affordable because we stretched it out a little bit longer.
Okay, good. You know, and people need to know, look, I'm not endorsing you on the interview. I'm just asking the questions. But my father, I think I've told you, got dental implants. He started out with the more affordable option, snap in, snap out. 2 years later, now he's got a full arch of teeth on the upper and lower that don't come out. Mm-hmm. And I could bore you with his story, but you know, he loves it. He said, I should have, in fact, he's mad at me. He goes, Randy, you should have talked me into this 20 years ago, right?
Yes.
And I go, well, Dad, I've only known about this for about 15 years.
We hear that all the time at our office. We had a patient come in the other day. She sat down in a chair and she said, how come you didn't tell me about these smaller diameter, these mini implants? And I said, I haven't seen it for a couple years. I said, I started doing them probably 3 or 4 years ago. I was doing traditional. And we talked about traditional, but it was too expensive. But now we're able to do it. We had the materials to make it work now.
So you did the traditional implants in the old days. So there's a lot of people that didn't do it just because they were too expensive. So what do you say to those people? Maybe they stumble onto the program and they're seeing this.
I tell you, I wish I was doing it 4, 5, or 6 years ago, these small diameters. I had so many patients that would come in and they wanted implants. Everybody wants implants.
They all want teeth.
They all want teeth.
Okay.
Exactly. Something that don't come out. That's what they want. And the driving force was because the cost of them. Because you had at least 1 or 2, you had at least 2 surgeries. That's if you had enough bone. So with these smaller diameter implants, it's changed everything. Now people come in, now it puts it into everybody's wheelhouse on getting the denture, getting the teeth made and getting it done.
Okay.
Because it drove down the cost by in half.
Is that right?
Yes.
So they could finance it. So there's no more excuses anymore.
No, there's no more excuses for getting it. We got financing available. We have, and the cost is about in half.
Now, I know, and we're short on time, and I know you flew out here, we're in California, to do this interview. When you flew over here, like when you're thinking what you're gonna say on the interview, like what's your main message? What do you want people to know about mini implants?
I want people to know about mini implants is that I can help you. If you have teeth that are discolored, if you have infection, bad breath, if you have things going on, you can't eat what you want to eat. You can't do the things you want to do because of your teeth. I can help you. Just come in, sit down, talk to me. We'll have a cup of coffee and we'll discuss what's going on and what we can do to help you.
Okay, it's a free consultation to come in?
It's a free consultation. We have, like I said, we got all kinds of financing institutions that we can put you through, get you approved for. But it's another way than wearing them dentures that's not attached. We can definitely help you.
You've been a dentist for more than 20 years, so I'm sure you fitted a lot of people for dentures over the years.
Yes.
In the old days.
Yes.
What do you say to those people that you did that, the regular dentures, and they see this program?
I want to tell them that that's another way. Come back in. You don't have to have that denture covering the roof of your mouth. You don't have to be wearing the glue. You don't have to be going online to see what the restaurant is serving.
Is that what seems to be the number one thing that they want to eat after they get it all done?
The ladies in my practice, they want to have a nice salad, believe it or not.
Okay.
I'm not a big salad person, as you can tell, but the men in my practice, they want to have a steak and eat hamburgers. They won't just be able to just bite into a steak.
Because I guess with dentures, you can't really tug on bite into a sandwich.
You are correct. They flip out. Guys, like I said, corn on the cob, steaks, women, salads. And just be able to smile, be able to sneeze, and your denture not want to fly out your mouth and all that kind of stuff. We have a Longhorn Steakhouse, and that's where the guys want to go. They want to go to Longhorn Steakhouse and have whatever they want to have there. And take the wives, and the wives are going to have the salad.
Now, what about pain? Because it seems painful.
It's very minimal. It's very minimal with the pain. We do a lot of surgeries, and I tell people most of the time I'm gonna give you some Motrin. You might have 1 or 2 days of discomfort, but after that, compared to the traditional, it's a lot better.
So you also offer IV sedation.
Yes.
But you say not everybody takes advantage of this.
No, not a lot of people take advantage of it. I offer IV sedation. We'll monitor your blood pressure. We'll check you, make sure everything's fine. We have a pulse ox there where we make sure everything's good. I start the IV personally.
Okay.
It's just, and 95% of the people don't remember after the surgery is done.
They remember very little.
Oh, very little.
Okay.
Oh, very little, yes. Or we can do it with a simple, just a little bit of a tablet that we grind up, put it up under the tongue. And it takes a little bit longer for that to work, but it works just the same. Well, not most of the people don't remember anything, or it just makes you just more relaxed to go through the whole procedure. And what I found is, whether it's the IV or the oral sedation, once a person's more relaxed, it seems like the healing's faster because the body's not so uptight. So, but we do offer that, and it's on what you want.
Who complains more about pain, the men or the women?
Oh, the man for sure. The man for sure.
The
yes.
tougher the guy, the more he's going to complain about.
Yes, yes. You can. If the guy's over 5 foot, he's going to complain more than a woman.
Is that right?
Yes.
Okay, time for a couple more photos. We got about a minute left.
I'm going to do this one. This is one of my favorite ones. This gentleman came in with his mother. He had got his teeth taken out. Probably was about 14, 15 years old. His mom came in with his mom, and he couldn't wear a denture. Dentist made him a denture, couldn't wear it, choked on it, the whole 9 yards. We gave him came in, sweetest kid. We gave him a full set of teeth, upper and lower, fixed.
Nice.
And first thing he said was he's going to get him a girlfriend.
Is that right?
Yes. So he's working on his girlfriend and his beautiful smile.
So it's like a third set of teeth for this guy.
He's got his third set of teeth. Now he couldn't eat before. He had to eat all soft foods, and now he's eating what he wants to eat.
So that's way too young to be wearing a denture.
Yes, anybody is too young to be wearing a denture, period.
So you're going to wipe him out in Ohio?
I'm going to do my best.
Okay.
And I got one more.
All right.
This young man came in. He had the same situation, but he still had his lower teeth. Another dentist had taken out his upper teeth, delivered him a denture. He sat right down in my chair, said, pulled it out, said, I can't wear this. I cannot wear this. Can you help me? We did some imaging, and we could help him. And we gave him a full set of permanent teeth on the top. Comes in smiling ear to ear.
It's a good looking smile.
Yes, and he's getting married. So I don't know if the teeth.
All because of his teeth.
That's what I'm gonna say. But I don't know if it's because of his teeth. But now he's getting married. I don't know if he's waiting till everything got done, but he's getting married now. And I've been invited to the wedding.
Nice.
Yes.
Very, very nice. So I sarcastically said because of the teeth, but I guess if you're confident, if your self-confidence is back, that's attractive.
Yes.
Charisma.
Yes.
Is tied to the smile.
Yes.
You were saying, and we really are out of time, but the people with bad teeth are judged. Elaborate on that.
Yes, they're judged. It's just like if you had two twins, and I think I talked about this last time. You got two twins, one's smiling, one's not smiling, and I'm trying to hire somebody. I always hire the person that has the confidence, and the confidence comes from the smile. If they come in there smiling, then you're going to give that person a job. It's just like when you go to a restaurant. Who do they have up front? The seating you. They usually have a person with a beautiful smile. They don't have the person with the holes in the teeth and the smile that doesn't, and they're trying to hide their smile because usually they look like they're mad. Also, we have, I got this lady right here. She came in, and you can see her teeth there. And what she wanted was, she wanted to be able to smile and be able to eat what she wanted to eat. So we took out her upper teeth, and we gave her a snap in, snap out teeth on the top. And she's doing fine. We was able to take some of the roof of the denture out, so now she can taste food, because that's huge with denture wearers.
Okay.
This lady came in and she had seen an interview, and she came in, she hated her denture that she had. And one afternoon, we was able to deliver a fixed set of teeth to her. And now she's smiling big, and as you can see with the picture. And she doesn't have to think about what she's going to eat. She smiles all the time. Now when she comes in, she's happy.
Okay, good. So we are out of time. Final message to a patient that's watching this. Maybe they've seen your interviews before, but for whatever reason, they're putting it off. Maybe they think they're too old. For whatever reason, they're just not doing anything. What do you say to them?
I say, come in, talk to us, see what we can do for you. I'm absolutely sure if you're wearing a denture, we can help you. If you have bad breath, come in and talk to us so we can see what we can do to help you. It's something out there that we can do. And
you have financing?
Yes, we
available?
We do have financing available. We got 2 years interest free, and we can even go longer. It'd be a small interest with the 5 or 6 years, but we definitely have different.
And people are doing that every single day. They're financing these procedures
every day. The girls in my office are fantastic at fitting into your budget.
Okay, good. And you have to have okay credit to get this done.
Yes,
but you'll work with them.
Yes, you have to have good credit, a fair credit, the good credit to get this done, but we'll work with you. We'll put the time and effort in to get you financed so we can get this done for you, so you can have your beautiful smile or eat whatever you want to eat.
Okay, good. I want to thank you for coming on the show. Always a pleasure to have you on the program.
Thank you. Thank you very much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.